in order to hammer home the reality to all of you who still haven't gotten the message. Here in Chicago, when it comes to staying home and being responsible, most Chicagoans have been doing their part, but many have not, and you know who you are. Over the past few days, we've seen crowds of 100 or more congregating together, particularly along our lakefront and along the 606 and other places. This is a blatant violation of Governor Pritzker's stay-at-home order. Your conduct, yours, is posing a direct threat to our public health. And without question, your continued failure to abide by these life-saving orders will erase any progress that we have made over the past week in slowing the spread of this disease and could lead to more deaths. This is a city of broad shoulders, big hearts, but ultimately, we must be a city who works together. And what we must do now together is bend the curve of this disease. That is why, effective immediately, I have ordered the closure of Chicago's lakefront from north to south and south to north, along with our 606 trail and the Riverwalk. This order is being executed through our Department of Public Health in collaboration with our parks and the Chicago Police Department. This closure includes trails, bike paths, green spaces, facilities, and parks adjacent to the lakefront until the Public Health Commissioner determines that this threat of our lives is over. To ensure this is enforced, the Chicago Police Department will be aggressively ramping up patrols in these areas. They'll start with a warning, if necessary, a ticket. And for those of you who refuse to abide by this common sense directive to help save lives, we will arrest you. We are asking you to employ social distancing techniques while engaging in recreational activities like walking, biking, and jogging. You can do this, but you have to do it safely. You simply cannot congregate. You must avoid crowds. And for those of you who bike and use the paths that are now going to be closed, please go to chicago.gov/CDOT and look for alternative routes for you to use in biking. This order also restricts any and all contact sports like basketball, soccer, and football. I've seen, and we've had repeated reports of people engaging in full contact sports as if this virus isn't serious. A pandemic means it's here in our midst every day, and we've got to all do our part. It's not for me to just do, it's for you to do your part to help stem the spread of this disease. And we will strictly enforce these rules. Folks, we can't mess around with this 1 second longer. We've seen around the world example after example of what happens when communities don't take this threat seriously. When individuals like you don't do your part and act responsibly. And I will do everything in my power as mayor to ensure that that doesn't happen in the city of Chicago. Now, I want to be crystal clear on this. I absolutely understand the frustration people feel about being stuck inside. And I absolutely understand that many of you have daily exercise routines, and that is an important thing to relieve stress. We're not saying that you can't exercise, but we're saying that you cannot congregate. Our lakefront is our treasure. It's really our jewel and sets us apart from any other place in the world. But congregating on our lakefront, to be blunt, is going to create a risk that is unacceptable and could lead to death. That is why we are taking these actions and going back and saying again, dear God, stay home, save lives. the more people will die if we do not abide by this simple but important order. Now, while today's measures may seem extreme to some people, I won't hesitate to take any further action needed as dictated by the science and the data if we need to do more to reinforce to those of you who have failed to get the message. You cannot congregate, pure and simple. And this includes neighborhood parks and playgrounds. And think about, yes, we're shutting down the lakefront, but what that doesn't mean is people should mass inland in other parks, playgrounds, and other places. You cannot congregate anywhere in the city of Chicago if you want to save your life. I will take the action that is necessary to make sure that we are leading in this fight. All of our area mayors, including those that are here today, have been experiencing the same challenges regarding blatant non-compliance with the governor's order. And the bottom line for us is about saving lives and getting our cities and towns back on track. As I said yesterday, there's no magic wand that will fix this problem. Each of us, each of you, has a role to play. Never before in our lifetime have individual actions impacted the very health and well-being of so many others. We are all in this together. We say that with great frequency. But that phrase has particular deep meaning and consequence in this crisis. We are truly in this together. And the only way we will get through this is by all of us working together, each of you doing your part to limit your activities and to stay at home to save lives. As I've said before, for the most part, Chicagoans have been faithfully abiding by this mission. And I want to thank each of you who are doing your part. But for those of you who need reminding, stay at home means what it says. With the exception of leaving your home to go on brief walks in your neighborhood, with practicing social distancing, or to purchase food or other essentials, you must stay at home. Period. I'm sure this is going to be a time of stress and confusion, but the ask and really the order is simple. Stay home, save lives. That's what we need. That's what must happen. And at this point, I will call upon Park Superintendent Mike Kelly to share a few words about the impact of this new order on the parks. Mike?
Thank you, Mayor. I think she's pretty clear on her point right there. Look, closure of parks, the closure of all the parks east of Lakeshore Drive is not an easy one. I'm the parks guy. I'm a father of 4. Nobody wants to restrict access to parks less than me. But, you know, I'm going to be frank, what we saw yesterday at the lakefront, what we saw yesterday at the Bloomingdale Trail, the 606, that is a very real and direct threat to the health and well-being of everyone in this city, and it has to stop. What do I tell people? Dr. Arwoody and the mayor have said repeatedly a very simple message: stay home. Stay home until you have to go out for an essential task. And if you got to go out, social distancing, 6 feet or more. It's pretty straightforward. I want to remind everyone that as far as all the other neighborhood parks go, the field houses are closed, the playgrounds are closed. We're locking them all up. So that's it. I mean, it's a very straightforward message. Stay home, comply with the order, let's beat this pandemic, and then we can get back out in the parks and enjoy our lakefront and everything the city has to offer. And with that, I'm going to turn it over to the Police Superintendent, Charlie Beck.
Thank you, Superintendent Kelly. So yesterday we had a press conference much like this one. After that press conference, I went out to Lakeshore Drive. I drove the lakefront from north to south in Chicago's borders. I saw thousands of people doing things that I personally love to do. Walking, running, biking, but in such numbers that it did something that I have spent the last 4 decades of my life trying to prevent. What I really saw was thousands of people risking their own lives and putting other people's lives in danger. This is serious business. This is not a game. This is not a time to think about your own physical strength and conditioning over public health. All of us have to make sacrifices. Just like the 13,600 men and women of the Chicago Police Department that are going out, making contact with the public every day and risking their health for you, you have to make sacrifices to keep your neighborhoods healthy, our elders healthy, our children healthy, and yourselves healthy. Now, while we are closing the lakefront and many of its adjacent confines to public usage, we still have the rest of the city. And I will remind everybody that the Chicago Police Department will be enforcing the public health orders throughout the city. I will also remind you that there is no time specific for this enforcement. This is a 24/7 order. There's been some confusion, although much information that pushes back on that confusion, some confusion that this order only applies to nighttime or sometime after 5. That is not true. This is a 24/7 legal order to comply with the public health standards as put forward by the governor, the mayor, and our Chicago Department of Public Health. We will enforce this vigorously. We won't do it because we want to. We won't do it because we like to. We won't do it because it brings us any joy. We will do it to save your life. So please help us. I would love to say the next time that we meet that we had total compliance and there were no citations or arrests. But I fear that won't be true. Please don't make one of those citations be yours. And with that, I'll bring up a true expert in the subject, somebody that I think has been a tremendous leader alongside the mayor in working Chicago through this crisis, and that's Dr. Arwady from the Chicago Department of Public Health. Doctor.
Thank you, and thanks really to everyone for the partnership on this. So we are doing everything we can to get this message out, but I do share the mayor's concern that it is not being taken seriously enough. That's why I signed this order today, closing the Lakefront Trail, the adjacent parks, the 606, and the Riverwalk. This was hard for me to do. During normal times, I lead Chicago Architecture Center boat tours along the river. I love going along the lakefront. It's one of my favorite things about Chicago, and I know it's many of yours. But I know you've all heard by now a lot this phrase about bending the curve or flattening the curve. I hope that it is not starting to lose meaning, because when we talk about flattening the curve, we're talking about protecting our health system and in turn saving lives. So staying home and proper social distancing is the best way to achieve that. The window to pursue a wide-ranging, aggressive response to the coronavirus pandemic is closing. The moves that we make right now, really these next few weeks, are crucial. They will shape the COVID trajectory in Chicago. I want to give you first a real-world example from Italy. As you know, Italy has become the epicenter of this outbreak. And there are two regions in northern Italy that took two different approaches, one with earlier and much stricter social distancing, the other later. Guidelines not as strictly enforced. The region that took the more aggressive action has seen a much slower rate of increase in COVID cases, and importantly, their hospitals have been able to better keep up with that surge. Patients who have needed hospital beds, patients who have needed ICU care, patients who have needed ventilators have been much more able to get them in that region than they have in the one that did not take it as aggressively. This is evidence, the sacrifices that you are making by staying at home, that we all are making by giving up some of the most beautiful parts of our city. This is evidence those sacrifices are not for nothing. We want to be like the region in Italy that slowed the rate and flattened the curve. We're coming to you every day trying to keep you updated on the pandemic, but we cannot do it alone. We need your help. We need you to take this seriously. Now is the time. Also, closer to home, I want to just tell you about something I was doing this morning. One of the reasons I felt comfortable making this difficult decision is because at this point, we have 949 lab-confirmed cases here in Chicago. We will be at 1,000 by the time we're talking tomorrow, for sure. That number is going to go up. And as long as just one patient with coronavirus spreads to just 2 other people, it doesn't sound like a lot when you think about just one person, but one person spreading to 2 or 3 other people means a continued exponential rise in that curve. We have to get that down so that one person on average is spreading to fewer than one person. That's actually what changes it. We don't have a vaccine. We don't have a treatment. The way we do that is by stopping more infections. And we stop more infections by having fewer people coming into close contact with each other. We have dozens and dozens of patients right now in intensive care units, on ventilators in Chicago. Our hospitals do have capacity right now, but they may not very soon. Per our pandemic planning, we're looking at a lot of options. We're building serious surge capacity. You've heard us talking about the fact that we have not just a few, but a few thousand hotel rooms already secured. We've been working with the Y and other partners to be able to expand and social distance appropriately Chicago residents who may be homeless. We've been working with the state, looking at hospitals that have been recently closed. How can we open those? How can we staff those? How can we get the equipment in place? And this morning, I spent time with folks from the state, folks from my team, folks from the Army Corps of Engineers at McCormick Place. We were looking at what it would take, not in a theoretical way, but in an actual way, to lay out potentially thousands of beds in the conference center that is the symbol of, our city's great tourism and potential. I want to thank everyone who is working on that difficult project. It is part of our pandemic planning, but it is not something that I have ever wanted to consider seriously doing in Chicago. But we're talking about it, not in theoretical ways. We're working right now to do everything we can to protect our healthcare system, to keep people out of it who do not need to be there. And that's another reason why you've heard us saying so much, if you are sick, you stay home. That's another legal order that we have in place. Limiting new infections, limiting new hospital patients is the most important thing we can do as a city right now. One other point. I've talked a lot about the pandemic exercise planning that we did last summer. I've not publicly said before, one of the things that we do as part of that planning is think about something called fatality management. What happens if more people are dying than our typical system would be able to handle? And so last summer, we put up mobile morgues in the parking lot near the health department. We brought in pathologists from around the city to really understand what that would look like if we had to expand that capacity. Now, don't get me wrong, we have not stood any of these up, but the fact that we're thinking about them again in serious ways, that we're talking about them, is because we cannot waste another minute of not taking this seriously. We have to do everything we can to protect our health system. In doing that, we protect you. Stay home, save lives. A few quick details related to the order. On my Facebook live stream today, we talked about mental health. Getting outside is important for your mental health, but it is not the time to be training for your next marathon. It's not the time to be going where many other people are going. I want you out. I want you getting exercise and fresh air. I want your kids out, but no playgrounds, no contact sports, no going places where others are going. And try to do what you can that's best for your mental health. Get your heart rate up every day. But really the most important thing is if you have a choice, stay home. You can walk the dog, but don't congregate at the dog park or where others are. If you need to go out, if you need to go to the grocery store, practice the social distancing. And definitely, nobody goes out if they are sick, even a little bit sick. We all have our role to play. I'm sorry to have to be closing the lakefront and making these changes. Really, it's difficult, but it is the right thing to do. And I care more about not having to use some of those really extreme things that we have in our pandemic planning. So please take it seriously. And with that, I will bring up Joseph Tamburino, who is the mayor of the city of Hillside.
Thank you, Dr. Awadi, for your remarks. Good afternoon, everyone. As you have heard from Mayor Lightfoot, when it comes to COVID-19 pandemic, we're all in this together. We see our residents traveling from the suburbs to Chicago, from Chicago to the suburbs, and this is happening every day. Any order by any city or town is only as strong as the people around it. That is why, on behalf of the regional mayors, I want to express full and unequivocal support for the strong and necessary measures that Mayor Lightfoot has laid out today and has brought forth today. As the mayor said, this is no time to mess around. We are doing what we need to do to stop the spread of this disease, bend the curve in Illinois and save lives, and ultimately get things back to normal. But in order to do that, we all need to know what the alternatives look like. Now, none of us want to see that here in Illinois at all. I want to take this opportunity personally to thank Mayor Lightfoot for her leadership, for her coordination, for engagement in the Chicago regional mayors that has been taking place since the very beginning and when this has become about. From the beginning of this crisis, she and her team has been in constant communication and coordination with all of us, informing us and providing resource sharing for all of us. And we all appreciate her leadership, and we thank her and her staff for all that they have done to keep us informed on what's going on and to work together with this. I can't emphasize this enough. With that, I'd like to introduce the Mayor of Robbins, Mayor Ward, Tyrone Ward, who has come in today also.
Thank you, Mayor Tamburino. Good afternoon, everyone. I want to thank Mayor Lightfoot for inviting me here to stand with you all today. I truly appreciate the collaboration that she started with the mayors of every corner of this region. Because we have to stand together, we're going to stop the spread of the COVID-19. Once again, we are all in this together. In my town of Robbins, we work tirelessly every day and every night, doing things like making sure that we are the ones out feeding and delivering food to all our seniors. And we meet on a weekly basis with all our local stakeholders to make sure that we're in sync. This and so many other steps that are being taken across the region are being done to stop the spread. But these measures will not work if we don't all cooperate. I know it's a sacrifice, but it cannot be stressed enough. It will save lives if you stay home. Myself, the mayors here today, and many others will be working together on this to move us forward and do everything we can to stop the spread of this disease. Again, thank you for your leadership, Mayor Lightfoot. And as I always say, thank you, everyone, for staying at home, but know that you are not alone.
Good afternoon. My name is Donnie Schmidt. I'm the mayor of the Village of Fox Lake and president of Lake County Municipal League. I'd like to thank Mayor Lightfoot for her strong leadership on this issue and for bringing us all together to be a united front against the spread of COVID-19. COVID-19 does not discriminate. Doesn't care if you live in a bustling city or a small town. If we don't continue to take bold action, we're all headed for trouble. If we're going to stop the spread, every resident in every town needs to stay at home. I know the measures we're implementing across the state may seem extreme, and I know some people think COVID-19 doesn't or won't affect them. But the simple fact is, if we don't stop the spread, we'll continue to see cases and fatalities. You probably all know someone with a grandparent or someone with a compromised immune system or underlying health conditions. Please do this for them. All we're asking of you is to stay home. The duty of all us mayors and elected officials is to provide essential services to our residents. Some of the essential services are obvious, like public safety. When you call 911, you want someone to answer the phone. When you have a situation and call the police or fire, you want them to come. Other essential services aren't so obvious, like public works. When you turn on the faucet, you expect water to come out. When you pull the plug on the drain in your bathtub, you expect the water to go somewhere. We have very small workforces in our municipalities, and we're doing everything we can to realign our workforces to ensure that we will continue to provide these essential services. Again, I'd like to thank Mayor Lightfoot for connecting all the regions of the state to reinforce this message. Stay home, save lives. Thank you. Now I'd like to introduce Mayor Maria, Mayor of Morton Grove and President of Northwest Municipal Conference. Thank you.
Thank you, Mayor Schmidt. Thank you, Mayor Lightfoot, for your continued commitment to fighting COVID-19. We appreciate that you have always looked out for our suburbs as well as the city. And I'm proud to stand here with all the mayors from around the region today to take stronger measures in this fight against COVID-19. I think the message, everybody's already been saying it, is this: it's critically important that everyone follows the orders that we are given. I know in Morton Grove we do a reverse 911 system. We don't take that lightly. But we're lucky to live in a time of technology that you can work from home, that we can call all the houses we can through technology, phone technology. So please listen when you get these reach outs, whether it's from Mayor Lightfoot in Chicago or any one of us suburban mayors. Please listen to what we're saying and try isn't even a good word now. It's please conform to what we're saying. We are all in this together. We have to stop the spread and slow it down, not only to save lives, but to have adequate resources for when this comes down the road. And it is going to come down the road. But one thing I do believe in is that together, as human beings in the human race, we're going to get through this. But we have to work together to do that. And as a unified front, we can stop the spread. And again, I do want to thank Mayor Lightfoot for including us suburban mayors. I also want everyone to please stay safe. Simple things: wash your hands, stay home unless you have to absolutely go out for groceries or to the pharmacy. Again, thank you very much for hosting this. We appreciate it. Can't thank you enough.
And with that, we're happy to take your questions.
Mayor, I'm the
Go ahead, Dana.
pool-
You're
I'm
the pool reporter.
I have a
Yes.
whole list, but I'll start, and I'm going to try to cluster some of them. One, some question the legal authority that you might have, not to close parks necessarily, but then to arrest people who are out in public. Some are concerned and say, are we on the verge of martial law? And with that also, was the majority of the lakefront problem yesterday on the north side primarily, or was it also in other places too, like Hyde Park?
It was all along the lakefront. I mean, obviously, as a matter of fact, there's a lot more population that's driving to the lake from, I'd say, the museum campus north, but it was all along the lakefront. So, and you look at the 606 in other parts of the city, the bottom line here is we're not saying that people can't leave their home ever. We're not saying that you shouldn't exercise. It's a great stress reliever. People want to stay in shape. We get that. The problem isn't the activity, it's the congregation. And if you look at these pictures from, this is right near Chicago Avenue yesterday. Look at the number of people that are out there. And it was like this all day long. We had a press conference yesterday at about the same time, asking for people to not congregate, to stay at home. I walked back into my office, and this is what I saw on cameras. And I was getting calls from people all across the city, talking about people playing basketball and soccer, contact sports, in parks. So we had to take these drastic steps. We've seen the numbers, we've seen the projections. This is about, it truly is about saving lives.
Can you go back and address the
authority?
legal authority?
Yeah, we have the authority under the municipal code. The public health director has very broad authorities under the code. Obviously, we have the lawyers scrub this 20 ways from Sunday, but I feel very confident that we have the ability to take the steps that are necessary to keep the public safe in what is clearly a public health crisis.
This may be for the interim superintendent, what would people ultimately be arrested for? What would that charge be? Will CPD officers ask for IDs of people that are given warnings, and will they keep a record of those that are warned? And finally, can you say how many citations have already been issued, if any, since yesterday?
So let me start, and then I'll call the superintendent back. Look, folks, what we want is to people to comply. We want to educate people into compliance. In this time, the last thing that we want is to have to use valuable first responder resources to get people to comply with the law, but we will if we must. And what people are going to be given is, as Superintendent Beck said yesterday, a warning, and most people comply with that. But if not, then we'll escalate to writing a ticket. And unfortunately, if we have to go beyond that, we will arrest. That should never happen because people, meaning you, need to comply. I understand that this is a difficult time, but we have to have full compliance with this order all across the city, 24/7. Superintendent?
So we gave warnings to crowds of individuals 56 times yesterday. We did not document necessarily the individuals involved. We have made one arrest and citation for crime related to failure to obey a health order as posed by a police officer. There's very specific language in the municipal code which gives us this authority. If a police officer is enforcing a health order, that is absolutely, and a person refuses, that is absolutely cause for citation and or arrest and a fine up to $500.
Okay. So do you know specifically how many citations were issued? I'm sorry, I missed that.
We have issued at least one that I know of, and it ended up resulting in an arrest. The vast majority of people complied, but our concern, and the reason for doing this, is that it took so much effort to get people to comply, and they were placing themselves at risk. So what happens is, even if we order you to disperse and you comply, Well, you've already put yourself and your family at risk. You know, we did not fix the problem by doing that. We just temporarily removed you from the situation. You have already put yourself in danger. You have already put your neighbors in danger. You have already violated the order. Now, you know, if it gets to the point where we would do as we do with a traffic citation, where we cite upon observance of the violation, you know, I don't want to go there. I mean, I want to do the warnings, but I would need people not to put us in that position in the first place. You know, everybody knows what the law is. You know, you have had multiple opportunities to have it explained. We've done it in very, very public settings. Follow the law. You know, don't make us enforce the law through citation and or arrest. Follow it voluntarily, and then we won't even have to get to this point. You know, I take no pleasure in enforcing this, because it's, once we do the enforcement, you've already put yourself at risk. It's too late.
So it sounds like they would be arrested for disobeying or defying a public order, not like disorderly conduct.
Well, the disorderly conduct section broadly encompasses refusal to obey a police order too. There are very broad sections that give police officers the authority to enforce these public health orders, and there's actually 2 of them within the municipal code.
Question from WBEZ. Are you concerned that these closures will put a strain on CPD's already fraught relationship with the community? And also, to add to that, will someone get harassed if they walk in a park, both a park that is now closed and also a park that is not closed?
Well, harassed is not the term I would use for a police officer enforcing a lawful order. You know, I think that is that's a pejorative term for a contact, so I would not use that term. If somebody is in one of the closed areas, they may well be cited. You know, this is you have to go by barricades, you have to go by signage. You know, that is an order. You know, that, well, in an open park, if they are not in one of the closed areas of the park, in the playground, at the field house, in one of the sports courts that is signaged as closed, then if they are congregating in groups, they may get a warning. If they're, as an example has happened multiple times yesterday, if you're playing soccer in a park, you know, with a group of individuals, that's not appropriate distancing. That's a contact sport.
And can you address the first part of that question from WBEZ? Are concerned about closures will put a strain on CPD's already fraught relationship in some cases with certain communities?
Well, you know, anytime you enforce the law, you know, you are doing something that somebody will have a disagreement with, even if it's only the person that's having law enforced against them. But I think we are doing this for the public good. You know, we try to do it in the best way possible. We are certainly put in a posture that is unfamiliar to traditional law enforcement efforts, but it is something that we have to do. And we, you know, I would ask everybody, if this law is enforced in your presence, or if it's enforced on you, recognize that police officer is doing it for your safety. They're not doing it because they want to do it. They're not doing it because they take pleasure in it. They're doing it to keep you safe. And if that's not enough for you, they're doing it to keep everybody else safe from your activity. So this is very reckless activity. This is activity that puts many, many people at risk, and it needs to stop.
Mayor, a question from Mary Ann Ahern. The Chicago Teachers Union and the SEIU want guarantees before its members volunteer to help with childcare for workers, healthcare workers. They want guarantees that they would get COVID testing if needed, and PPEs, and even hand sanitizer. Where does the city stand?
Let me just say this. Volunteer or not, no one's making you do it. We want people who are among the willing. If they're not among the willing, don't do it. Obviously, we're taking every precaution that we possibly can to make sure that people who are stepping up in this time of need, as many great Chicagoans have done, we're going to make sure that they are got the proper training, make sure that if they are symptomatic, that we're getting them care and testing. But no one has to do volunteer work. And if the leadership of the CTU believes that their members don't want to step up, well, frankly, I've seen many teachers and other folks step up all over the city, but if the CTU leadership doesn't think that they have a role to play in the middle of this crisis and pandemic, that's on them.
Some may want to volunteer, following up on my own, some may want to volunteer but be concerned about their own exposure, though. Is the city doing anything to?
And if they volunteer, they will go through the proper training, and they will, again, they will be provided with the tools that they need to keep them safe. But if the CTU leadership doesn't want to step up in this time and have people volunteer, then they don't have to. Simple as that.
Superintendent, what were the circumstances of the arrest? Because you didn't really get into it, but when did it happen, and what were the circumstances of it?
Well, I'm not going to go into the entirety of the circumstances because I don't have them. It was a failure to obey a police officer's order in the 11th district. It got so aggravated that an arrest had to be made.
Question. Oh, sorry. We have a few questions that have come in. This question is from Omar at CNN. Mayor, does it concern you to see how the coronavirus has taken hold in places like New York and New Jersey? Is there anything you've been able to learn from their responses that can help here?
Well, first of all, it's a cautionary tale for all of us. We know that in New York, they've got the most robust public health system probably anywhere in the country. We know that they've got great dynamic leadership in their governor and their mayor in the New York City, and their healthcare workers are doing an incredible job under very difficult circumstances. It's hard to see that in one of the world's most important cities. So yes, there are a lot of lessons learned, and that's why we're taking the steps that we've taken. That's why we are going to continue to take the steps that we've taken to make sure that we do everything to keep people here in Chicago and in our region as safe as possible. Just reemphasize again, if you stay at home, you will save lives. Stay at home and save lives.
A couple questions from Fran Spielman. What is the city's policy for paying employees, both union and non-union, who call in sick or have a family member who is ill? And following up on that is, what is the absenteeism rate since the virus? Has it gone up?
Well, as we explained, I think a couple weeks ago, and we put out in written policy, anybody who is directly affected or has a family member that's directly affected, they're not going to have to burn through their sick time to be at home. We have had several people throughout city government who had pre-planned vacations that traveled to places that turned out like Italy to have this huge spread. We asked them to self-quarantine. Thankfully, those people didn't themselves exhibit any symptoms, but we're not making people burn out their sick time if they have tested positive for coronavirus or are the primary caretakers for someone who has. Absenteeism, we've seen some uptick, but nothing extraordinary at this point. We're monitoring it on a day-by-day basis. But, you know, people are doing what we've asked them to do, that if they're over 60, if they have an underlying condition, or if they're feeling sick, and as the doctor likes to say, even a little bit sick, to stay at home. And so we're seeing that, and we appreciate people who are following the directive and guidance that we've given.
One from Kelly from Block Club. How can people who are homeless get hotel rooms, and who or what number do they contact?
The way we've always done this in the city of Chicago is for people who are experiencing homelessness or need any other resources, call 311. 311 operators have been retrained in light of this COVID-19 virus. There's different lines that they will patch you to depending on what you need. But if you're homeless, if you need food or any other kind of support, just call 311.
Question from A.D. Quigg at Cranes. Could you please offer more details on plans for McCormick Place and whether a deal has yet been inked for Metro South?
We are close on Metro South, and as soon as we have the specifics done, we will certainly let members of the public know that. And on McCormick Place, as Dr. already indicated, we're having discussions in coordination and collaboration with the state and others to set up a number of hospital beds in the East Building at McCormick Place. But when those details are set, we'll also let you know about that.
And last question, follow-up question from ABC. That 40,000 hospital figure is insane. Can the mayor or Dr. Arwady give a time frame as to when that is expected or could happen?
There was a joke there somewhere in the use of the word insane. Look, what we know is this. We are looking at a number of different projections based upon modeling that is being done across the city. Ours, some hospitals are doing it, as well as the state. And that number is real, and it is sobering. It is sobering, which is why we are saying to people, you must stay at home. It is real. Thank you.
Yeah,
Oh,
Mayor.
go ahead, Dana.
Thank you. There's two different questions from two different people. One, but they're combined. They're the same sort of subjects. Cities like New York, LA have waived bus fares, and they're having people board through rear doors, chaining off or separating drivers from those who ride. Any plans on doing something like that here? And with that, from my colleague at CBS2, how should people practice social distancing on buses, some of which are still very, very crowded?
First and foremost, CTA, in response to this virus, only is using buses where, in effect, the driver has a see-through shield between the driver and the passengers that are boarding the bus. So those are the buses that are in operation now, and gives another layer of protection to the drivers. We are in conversation both with the CTA and the ATU union that represents the drivers to see if there's some additional measures that we need to take. We're aware of the fact that other cities have gone to rear boarding. Obviously, that has a cost component to it because then people won't be charged for the ride. But we're looking at all options that may need to be taken to add another measure of safety for people to ride public transit. And then in terms of the buses, we're trying to make sure, this is why we haven't reduced our service, because there are some lines where people still have to go to work, and we want to make sure they can do that safely and comply with social distancing. So what we're trying to do, obviously, is urge people to spread out at the bus stops themselves, to give the social distancing when they sit on the buses, and we're trying to run as many buses as frequently as we can to avoid the normal kind of packed rush hour buses that were the norm pre-COVID-19.
Can I ask one question for the suburban mayors? Anyone can grab it. Today we've heard, the city's lakefront, et cetera, shut down. Can any of the other mayors here address whether park closures are taking place in any other suburb outside of the city of Chicago?
In the Village of Hillside, we have closed our playground areas, and the smaller tot-type parks are closed.
Enforcing them as well?
Absolutely, absolutely. And we've had complete compliance. We haven't had a problem with it as of yet.
Thank you, guys.
Thank you all.
Thank you.